my name is Yusnita, and in here we are going to have videos for assessment, which means for assessment upper limb tension test and for lower limb test for especially for hip joint.
Okay, enjoy your watching. Bye guys.
Okay, in this video, I will demonstrate the test, upper limb tension test A, or it's for check the median nerve. Of the patient is lying supine, and then after that, depress the shoulder of the patient, and then abduct the forearm in 90 until 110, and then rotate elbow is flexions, and then rotate the forearm. And then extend the wrist, and then forearm supinate, and then extend the wrist and finger, and then after that bring to the extension of the elbow, and then after that if the patients feel pain, that means the patients have the positive sign, and to make sure that if the patients have the median nerve to confirm. So ask the patients to bend the neck into the collateral side.
Okay, in the next video it's about the special test in the upper limb, which is upper limb tension test B or upper limb tension test 2. Is to check whether there is an injury in the median nerve, axillary nerve, and then musculocutaneous nerve. For the first is ask the patients to lying supine with the edge of the bed, and for the first the position of the examiner at the side that we want to check. For the first, we can depress the shoulder by our thigh. Depress shoulder in 10-degree abduction, and also elbow in 90-degree flexion with the forearm in supinate, wrist in extension, and also the finger in extension. And also slowly do the extension motion of the elbow. And then the positive sign if the patients feel pain. Also to confirm again, we can ask the patient to bend their neck to the contralateral side.
In the next video, I will check the upper limb tension test C, or for to check radial nerve. So in here, positions of the patients is supine, and then depress the patient's shoulder using the hip, and then positioning the arm is abduction 10 degrees, and then flexing the elbow, and then after that prone the forearm, and then flex the wrist and also the finger, and then for make sure to provoke the radial nerve is pain is by slightly for extension. And if the patient feel pain, that is the patients have the positive sign. And to make sure how to provoke more at the radial nerve is ask the patients for bending to the contralateral side of the neck.
Next, I will demonstrate how to perform the upper limb tension test D, is to check whether there is an injury in the ulnar nerve. For the first is patient's position in lying supine at the edge of the bed, and then for the examiner at the side that we want to check. For the first is depress the patient's shoulder, and then bring the shoulder abduction 90 degrees, and also the elbow flexion 90 degrees. Pronate the forearm, extend the wrist and then the finger, and also bring the hand to the ear. And then the positive side if the patient feel pain. And then for the confirm the finding, ask the patient to bend their neck to the contralateral. Okay, for the first assessment, we can do for the range of motion and also muscle strength of the hip abduction. Okay, for the patient's position in the lying supine, and then for the examined positions in the side that we want to check. And for the first is explain the procedure to the patients how the assessment will be performed. So we stabilize the patient's pelvic. Make sure that the pelvic in the same level by palpating the axis. And then for the active one, we can ask the patients to do by themselves for bring their leg moving away from the other leg. And then we measure the rest of motion using the goniometer with the fulcrum in the axis, and for the static arm parallel with the axis, and for the moving arm is following the mid of the thigh. And then next to the passive. For the passive is helping by the examiner, and then we can help to bring their leg move far away from the other leg with stabilizing the pelvis. And then we check using the goniometer with the same procedure. Okay, that is performed to check from hip abduction. Okay, for the next is muscle strength of hip abductor. We can start from the grade 3, meaning the patient is able to do hip abduction motion in full range of motion and against the gravity. For the patient's position in the lying side with the side that we want to check at the top, and also the examiner behind the patient. And then the examiner stabilize the pelvic and also ask the patient to lift up their leg by themselves. If the patient is able to do the grade 3, we can move to the grade 4 by give some resistance. In here, I give resistance at the knee joint area, and then ask the patient to lift up their leg again. And then if the patient still able to do this one, we can start to the grade 5 by give resistance, and I will give resistance around the ankle area, and then ask the patient to do the same procedure. And if the patient still able to against the resistance, the patients have the hip abductor grade 5. Okay, for the next is how to check the hip abductor grade 2. If the patient is not able to do the grade 3, so we continue to do the hip abductor grade 2. The patient's positions in lying supine with the examiner at the side that we want to check. And then for the grade 2 is ask the patient to move her leg away from the other leg by themselves, and then the examiner rotating the hip abductor at the lateral compartment. And if the patient is still able to do this movement, so the patient have MMT hip abductor grade 2. But if the patient not able, we continue to the grade 1. Still, ask the patient to move her leg away from the other leg, and then the examiner rotating the hip abductor. For the grade 1, if there is no movement but still have contraction of the hip abductor. And then for the grade 0 is there is no movement and then there is no muscle contraction at all. Thank you. Okay, in the next I will demonstrate about the ROM and MMT of hip adduction. The next is to check hip adduction range of motion, patients in lying supine, and then the examiner at the side that we want to check, and then don't forget to stabilize the pelvic. After that, we start from the active one by ask the patients to do by themselves to do movement to bring her leg crossing to the other leg, and the examiner still stabilize the balance. And then we check the range of motion using the goniometer with the fulcrum in the axis and static arm parallel with the other axis, and then for the moving arm following the midline of the thigh. And for the passive one is helping by the examiner. And then we support the patient's leg. So measure using the goniometer with the same procedure. Okay. This is for the range of motion, and then we continue to the hip adductor muscles. We can start from the grade 3, which is the patients in lying side, at the side that we want to check at the bottom. And then the positions of the examiner is behind the patient. For the first is lift up the top of the leg, support the patient's leg at the knee with our hand. And also, this is the side that we want to check. For the grade 3 is ask the patient to do by themselves. And then if the patient is able, we can start from the grade 4 by give the resistance around the knee joint. And then for the next is for the grade 5, we give the resistance around the ankle. And then if the patient is able, so the patient have the grade 5. And also continue to if the patient is not able to do the grade 3, we move to the grade 2 by patients lying supine. And then ask the patient to cross their leg to the other, and then the examiner help the medial aspect of the side to check the muscle contraction. Okay. And then for the grade 1, is ask the patients to contract their hip adductor, and then the examiner is palpating this muscle area. And then for the grade 0, if the patients not able to contract their muscle at all.
Okay, in the next video, I will show how to assess the range of motions and muscle strength, the hip flexion. So the first is there's two range of motions by active and passive. So for the active is doing by the patient self, and then for the passive is helping by the examiner. So the first is for the active. So ask the patients for leaving the hip and the leg for the lower leg side. And then first one is stabilize the pelvic. And then ask the patients to lift the hip by bend. And then put the goniometer at the GP area. And then for the stationary arm is same for the bed, and then for the moving arm is follow the thigh area. Okay. And the next is the passive range of motions. So in here, I help the patients to bending the hip. Saya bantu ya. And then put the goniometer at the fulcrum at the GP. And then for the stationary arm is on the same parallel with the bed. And then for the moving arm is following the lead of the pipe. The first is ask the patients to sitting. So for the check the muscle strength of the hip flexions, we start from the grade 3. So in here, ask the patients to lift the leg of the left side for the check. Boleh diangkat sendiri. So if the patient is able to lift it by herself, so it means that the patients have a grade 3, which is have a range of motion without any resistance. And then for the grade 4, for the examiner hands is holding the middle of the thigh of the patients, and then ask the patients to leaving the hip by themselves. Okay. If the patient is able to lifting the leg with some resistance, so the patients have the grade is 4. And then for the grade 5 is for the hands examiner is on the near to the knee joint, and then ask the patients to lift the leg by themselves. If the patients can able to do that, so the patients is mean that have grade is 5, which is great resistance and against the gravity. And then for the next is if the patients cannot able to do the grade 3, that means the patients is using the grade 2, 1 and 0. So for the positions of the muscle strength is grade 2, 1 and 0, the patient is lying supine. So the examiner positions will be on the behind of the patients, and then stabilizing the pelvic of the patients, and then ask the patients to flexing the leg by themselves, which the patient's hand, the examiner hands is on the anterior of the thigh to make sure that is the contractions of the hip flexion muscle. So in here, the patient's able to do full range of motions, but not against the gravity. That means the patient is have grade 2. And then for the grade 1 is by the patients is doing the same, but in here the examiner is the best examiner hands is on the anterior of the thigh of the flexions of the hip part, and then ask the patient for bending. But in here the patients just cannot move, but in the feels is there is a contractions of the muscles. And for the grade 0, there is no muscle contractions or movement at the hip joint. For the next video, I will demonstrate how to assess the range of motions and muscle strength for hip extension. So in here the range of motion is 2, active and passive. So for the active first is ask the patients for the position is prone, lying, and then positioning the pelvic in the same level. And then after that, ask the patients to lift up the leg by themselves. For the placement of the goniometer, the fulcrum will be at the GT, and then for the stationary arm will be parallel to the bed, and then for the moving arm, it's mid on the target. And then ask the patients to living up, and then support the patient's leg, and then put the goniometer on the GT for the fulcrum, and then for the stationary arm is on the bed, parallel with the bed, and then for moving arm is following mid of the thigh. And then the next is for the passive one. So the passive one is helping by the examiner. So using the same procedure, and then lift up the patient's leg around the ankle area, and then placement the gonio at the same place that previous, and then measure the extension of the hip joint. Okay, thank you. So the positions of the patients is prone, lying, and then ask the patients to lifting up the leg by themselves. And stabilize in the ankle area. If the patient is able to do lift the leg by themselves without any resistance, so that means the patients have a great easy with full range of motions and against the gravity. And then for the grade 4, ask the patients for lifting up the leg, and then for the examiner hands in the middle of the posterior of the thigh of the patients. And then stabilize the pelvic also. If the patient is able to do the lift up with some resistance on the leg, that means the patients have the grade is 4, and with against gravity. And for the grade 5, it's the patients lift up by themselves using with the hands of the examiner is near to the knee joint. And then for the other hand of the examiner is on the pelvic area to stabilize the pelvic. And then ask the patients to lifting their leg by themselves. If the patient is able to doing that, that means the patients have the grade for muscle strength is 5, which can against the gravity and against the resistance. So the first is the positioning of the patients is on the lying side. So in here the examiner will be on the back side of the patients, and then put the examiner hands at the pelvic area to stabilize, and then ask the patients for extend by the leg by themselves like this. So we start for ask the patients to bring the leg to posterior or back, and put the hands on the examiner on the posterior of the thigh. So that means that the patient is able to doing them by self without any against the gravity. And then for the grade 1 is for positioning of the hands of the examiner is on the behind of the buttock area, and then ask the patient to try the brain stereo.
Okay, the next video is I will do the demonstrate about the ROM and MMT of the hip external rotation. For the patient's position, patients in sitting position, and then for the examiner in front of the patient and at the side of the side that we want to check. And then for the active one, by ask the patient to do this movement or bring her leg to in. And then don't forget examiner to hold the patient's leg. And then we check the range of motion using the goniometer with the fulcrum at the patella. And then for the static arm is parallel with the bed, and for the moving arm is following the mid of the tibia. And then for the passive one, helping by the examiner with the side movement. And then same we measure with the goniometer. The next is for the muscle strength of the hip external rotation. Still in the same position, we start from the grade 3 and ask the patient, we should to stabilizing the patient's leg, and then ask the patient to bring her leg to in. And if the patient is able, we continue to the grade 4, still stabilize the leg, and then give some resistance at the mid of the tibia. And then if the patient is still able, we move to the grade 5 with the resistance at the ankle area. And then if the patient is able to against the resistance, the patient has the muscle strength grade 5. And then we continue to check the muscle strength of the grade 2. The patient's position is lying supine. The examiner at the side that we want to check. For the first, we can ask the patient to do external rotation, and then the examiner calculate the lateral aspect of the hip to check the muscle contraction. And then for the grade 1, the examiner still calculate the lateral aspect of the hip to check the muscle contraction, and then ask the patient to contract the muscle. And for the grade 0, it means that there is no contraction at all.
And the last video will be how to check the range of motions and the muscle strength of the hip internal rotations. So in here the positions of the patients is sitting positions with the 90 degree of the knee is flexions and the hip is flexions. And then the positions of the examiner is at the side of the patients. And then for the placement of the goniometer is on the mid of the patella. And then for the stationary arm is on the parallel with the bed, and then for the moving arm is on the mid of the tibia. So in here there's an active and a passive. So for the active is ask the patient to bring the leg inside and outside of the leg like this with themselves, and for the passive is bring the leg of the patient outside by helping from the examiner. So the first is for the active first. So ask the patient to bring her leg outside of the leg. Okay. And then we see that the patients have the active range of motion is some degree, and then for the passive one is by helping from the examiner and hold for the hands. The examiner is holding on the ankle area, and then stabilize the ankle part, and then bring the moving arm on the gonio, follow the tibia, mid of the tibia, and then we got some degree of the passive range of motions of internal hip joint patients. We get from the grade 3, 5, 4, and 5. So in here the patient's positions is on the sitting. So for the grade 3, examiner hands is stabilized of the tight area, and then ask the patients to bring their leg outside of the leg by themselves. So if the patient is able to doing that, that means the patient is can against gravity with full range of motions. And then for the grade 4, ask the patients for outside of the leg, and then put the hands on the minor into the medial of the knee, and then the lateral part is on the middle of the thigh. And then this is for check the grade 4. Ask the patient for bring up. If the patient able doing that, that means the patient can against the gravity with some resistance. And then for the grade 5, so the position is the same for the medial of the knee on the examiner hand, and then for the other examiner hand is on the lateral part of the ankle area. And then ask the patients to bring their leg outside. Okay, if the patients able doing that, that means the patients can against the gravity with the greater resistance. So the first, ask the patients to try to in one of the leg. So in here the positions of the patients is lying supine. So and then the hands of the examiner is on the lateral part of the hip joint area. And then ask patients to go internally of the leg by themselves. So in here the patients able to do the internally rotate with themselves without any against gravity, so that means the patients have the internal rotation is grade 2. And for the grade 1, so ask the patient with the same way, try to internally rotate by their leg, and then the examiner hands in on the lateral part of the thigh. In here, for the grade 1, the patients doesn't able to do the movement, but there is some contractions on the lateral part of the thigh. And for the grade 0, that means the patients not able to move, and there's no muscle contractions on the hip internal rotation.
Hi guys, thank you for watching our video, and we hope our video can give some information and some benefit for you guys. Thank you.
Don't forget to like, subscribe,
And comment.
Thank you guys.